So we were curious as to how patients feel about some of the novel approaches that we're developing for multiple myeloma, and to try and understand their preferences and how they view the data that's emerging. We conducted a large study across America and a number of different countries in the US. We studied approximately 300 patients across these different geographical locations. And what we did is with that, we pooled the data across all the clinical trials with novel agents. So we're talking about CAR T cells, bispecifics, antibody-drug conjugates, as well as some more standard treatments such as bortezomib, carfilzomib, and some of the immune modulatory agents. The patients were able to view the profiles of these drugs, including their efficacy and their safety profiles, and we followed it up with questions as to how they would view these treatments. Specifically, what we were trying to understand was what their views were according to the efficacy and the tolerability, and what sort of adverse event signals that they would be willing to tolerate in spite of the efficacy signals that we're receiving. The data was really interesting, and we've already shown some of the data for this, but in this particular study, what was incredibly interesting was something very obvious, but we often don't think about, and that's that not all patients are the same. And when we think about patient-reported outcomes, we need to remember that we're talking about a wide population of patients. We're all different. We all come from different ethnicities, races, cultural backgrounds, and socioeconomic backgrounds. And as a consequence, our views and expectations will differ. So when we ran this study across 300 patients across multiple geographical areas, we found and teased out 4 different groups of patients according to their responses. And what we found is that you could break them up. There was a group of patients who were most interested in maximizing their response rate. There were a group of patients who are most interested in maximizing their survival rate. There's a group of patients who are really more interested in the mode of delivery of the treatment. And across the board, everyone wanted to maximize the efficacy, but also across the board, they wanted to reduce the side effects. So what we know is that all patients generally want to live for longer or have a more efficacious treatment, and we know that generally across the board that they want a lower degree of side effects, but within them there's different preferences. So again, what was very interesting, when you look at the different product profiles, when you supply the information for a CAR T-cell product, despite the high efficacy rates, there was a lot of anxiety about the toxicity. And so to deal with the toxicity, the patients would expect a very high level of efficacy to offset that. Now, if we switch across to an antibody-drug conjugate, such as belantamab mafodotin, patients would be more accepting of the lower efficacy signal. The response rate we know is about 30%, because of the toxicity profile is much more manageable. And when it comes to the deliverability of these agents, we know that the whole process of CAR T-cell delivery can be quite burdensome in terms of the leukapheresis, the admission to hospital, whereas for some of the other conventional treatments, which are intravenous infusions given every 3 to 4 weeks, that's less burdensome, is more attractive. Having said that, what this data shows you is the patient's preferences when you give them information. It doesn't tell you the impact of the healthcare professional. And from my perspective, I know that CAR T-cell therapy is a very effective treatment. And what that tells you is that that bridge that the healthcare professional needs to overcome or cross for the patients to understand how efficacious some treatments are and how to process the offsetting of the toxicity signals. So I think it's really interesting, and just to summarize the 2 salient features. Number 1, not all patients are the same. Different patients have different expectations, and we need to understand that not everyone is the same. Number 2, we know that patients will be skewed in terms of what they want according to the information they receive, and it's the role of the healthcare professional to put this into context and to personalize it for the patient in front of you.